So I have a special guest here with me today. This is the real owner of Dykal Health and Wellness. This
That's
is our CEO, Mr. Kevin Clarke. You could look over there and the people could see you. Hi, Kevin. Good afternoon.
Hi, Renz. How are you?
It's good to see you.
It's always good to see you.
You're looking good.
I
You
know, I
look
know.
you look sexy. You look really sexy. I have a couple of questions for you. As a CEO, what are some of the things that you feel like are important to you for health maintenance? What would you be looking for if you were looking for a new clinician? Because I know you're not
I'm not looking for a new
ever
clinician.
looking for a new clinician, but what are some of the things as a CEO, as an owner of your own business, that are important to you as a man?
Well, definitely someone who's knowledgeable first and foremost. Someone who would clearly be able to guide me in the right direction, provide me with the necessary information that I would need to help me become or help me to optimize my health. Obviously, I am in healthcare now, so I understand those things. But from the perspective of someone who may not necessarily be in healthcare, what does health optimization look like? I would need my clinician to be able to guide me along that path, especially if I'm someone who's not quite familiar with what optimization looks like. Now, from being in healthcare, I've understood that health optimization is not just the absence of illness. I can be just sitting here feeling okay, but is my health optimized? Maybe I'm low on energy for today, and I'm like, it could be more than just you know I'm a little bit tired. It could be that my blood count is off in some area or the other, or some one of my blood samples is not reflecting the correct markers.
Sure.
But I wouldn't necessarily know that if I am not someone who is a part of the healthcare system or understanding of the healthcare system in depth. So
True.
those are some of the things I would want my clinician to be able to guide me through that process, and be knowledgeable about it, so that they'll be able to help me along the way.
Is it important about, honoring your time? Because I know as a CEO, you run your own business, but you also have other jobs and you have other related hats that you wear, so to speak. So, what would be important for you? Like office scheduling, timing, availability of after hours, concierge model. Are those things something that you feel like you could benefit from?
Most definitely. I mean, being a CEO and having to wear multiple hats, not only within healthcare, but also in other areas as well, you find that your time can be limited. And also, your time is not necessarily standard 9 to 5. You find that you may need an appointment that's outside of that window. So, how flexible, to some extent, is my healthcare provider? Can they take care of something at 7 p.m., possibly 6 p.m., possibly, versus having to make sure I take time off in the middle of the day to get that done? Or on an occasional Saturday or Sunday, and as a CEO, my days are filled every single day. So
Yeah.
it's, how do I find that pocket of time to make sure I take care of my health? And I also need to also dedicate time to that as well as an individual, because of course, if you're not healthy, everything else goes along the wayside, because you can't take care of all the other responsibilities that you have if you're not in your optimized health
So,
position.
do you feel like it would be better if you had a clinician who could possibly come to you, for example, in a concierge boutique manner, versus you having to take time off of your schedule to find time in your day or even carve out a little hour for yourself to go
Most
to their
definitely.
office? Okay.
Most definitely. If my clinician can actually come to me, that'll definitely save me time, because it might would have cost me about an extra hour
Mm-hmm.
just to get there. and then having to sit in the office for another 45 minutes and so on. That's probably 2 hours plus your time to reroute to get back on track to whatever else you were doing. You're talking about 2 3 hours out of your day, possibly even four, depending on how much you need done.
So
You know,
concierge boutique where maybe they
concierge,
can do
telehealth.
telehealth, they
Yep,
can do blood collection on the go, urine collection on the go,
yep.
see you for that full physical exam, and you don't even have to break a sweat because you could still be operating, your multiple roles at the same time.
Yeah, most
I
definitely,
love
most
that.
definitely.
I love that. And do you like an approach where things are booked and scheduled ahead for you? For example, if you had labs to do, are you feeling like it could benefit you where the team orchestrates the ordering of the labs, the scheduling of the labs, and all you have to do is to show up? Is that something that might be helpful as
Ordering, and possibly scheduling. It. I wouldn't say scheduling because my schedule is my schedule, and it's hard for others to be able to dictate that. And
right
it would be
challenging?
challenging
Mm-hmm.
to ensure that I'm going to meet someone else's schedule,
Mm-hmm.
especially if I've already been double booked or even triple booked for something. So I'd rather book my own individual things or have my own personal assistant be able to do that.
Okay.
However, scheduling these things, not scheduling, but ordering them probably would make the most sense,
Okay.
and then giving me options in terms of the scheduling times, then that could possibly work.
I love that. Yeah, see, at our company, this is what we offer, and we can readily talk about it because this is just something that we see in the market. The demand for having, different times of access, not just in the proverbial office hour time slot, right? Demand for flexibility and also accessibility to your clinician. So offering a service that is at a heightened level, it's everybody's a VIP, but it's a heightened level of service because it provides you with more access.
Mm-hmm.
It provides you with a greater sense of direction. You know exactly what to expect. They're coming to you, or a time is carved out. And another thing that I realized for us, Kevin, in our business is we deal with a lot of government clients, right? And, persons with top security. Security has been a big thing for us, maintaining that safety net, making sure persons feel safe coming to us, whatever hour of the day or night,
Most
right?
definitely.
So I think that that's also a big thing to notice. And privacy is huge in our business. It goes without saying because we're governed by HIPAA. However, protecting someone's private information and not having the world know that, okay, that's what you're taking care of them for, is top tier. And that is part of what we offer at Dykal. And because it's both of us working together, we don't have 1,000 different hands working in your personal health.
Correct.
If you're coming in
And the
for
unique thing about it is that we also do not have multiple bookings at the same time. So
exactly,
we're keeping you're individually booked. So it's your time.
yeah,
So you won't necessarily be crossing paths with someone else.
nobody else.
So you won't be able to see another individual to, oh,
I
I
know
thought
you.
I saw John Brown in the office the other day, or I
Yes,
saw Mary Jane in the office the other. No, it's nobody will be able to say they see you or they saw you somewhere. It's
yes,
your time is your time, and we have buffer and times in between slots as well. So
yes,
you're showing up at 10. There's not someone who's just walking out at 9:59,
yeah.
right? You're showing up at 10. Nobody was there prior to you.
And no
It's your
wait
time,
times, no
and no
double
wait times, no
bookings.
double bookings.
That's it.
Yeah,
Well, thank you, Mr. CEO, for joining us for this quick, impromptu discussion.
unexpected.
Unexpected, of course. That's how I am able to get him because he doesn't have the time. But I'm so happy that you've heard it from the proverbial person who this is what he does. If this matches what you'd love for yourself, please. Our link is in our bio. Bye.